lost in the Supreme Court. It was a Republican-dominated Supreme Court, and I lost some of those executive powers. We do retain some powers, but we are so incredibly divided after, I think, the politics of the last 14 months. And so it is a very difficult moment where I'm still trying to get the legislature to just deploy resources that the Trump administration sent us. So what might seem like a natural thing to do is much more complicated than what the CDC might suggest when you look at the reality here on the ground.
That was Governor Whitmer on the Chris Hayes program on MSNBC Thursday evening, giving us a pretty strong clue about why there haven't been stronger measures ordered in the face of the surging virus in Michigan. Republicans in Lansing have had some success with judges in limiting her powers, and she's left to basically plead with all of us to get our pandemic act together. That can't come soon enough for the state's hospitals, some of which are now at a crisis footing, which includes Beaumont Health Systems. I'm very glad to have the Vice President and Chief Operating Officer of Beaumont, Carolyn Wilson, to talk to us about it. Carolyn, tell me a little bit about what it means when a hospital says we're at a crisis.
What it means is that we're really full. Beaumont has been committed to its communities for years and throughout this pandemic over the last 14 months. And what we're seeing is a combination right now, an increase, obviously, in the number of COVID patients, and a lot of our community people that have delayed care that are also needing non-COVID care, needing for us to say, we're pretty full.
The non-COVID care part of this is everybody putting all those things off for a year, not wanting to go to the doctor, not wanting to go to the hospital. I guess we had to know that eventually that was all going to back up on us, right?
We were very, very concerned. Obviously, our clinicians stress the importance of preventative care and ongoing care of maintenance, for whether it's high blood pressure or anything else. And so we knew that in the first surge, which was different for us, people stayed home. And in a lot of ways, we told people to stay home. But now, 14 months later, a lot of our community members need care for heart disease and for cancer care and other things. And so it's the combination today.
We've talked a lot about the fact that it is younger patients now, younger than the ones that we saw coming in with COVID earlier, which is proof that the vaccine is working because it's the older folks who've had it. Are there other differences now, though, besides the age group, the demographics of it? Are there other differences with the COVID cases that are being treated now in the hospitals?
I think the biggest difference is we're seeing a lot of the cases have the variant associated with them. And what that means is it's just more contagious. And that's why we're really asking for the community to help us. Together, I'm a proud Michigander, and I know we all are. Together, we can curb this increased number by maintaining vigilance in our masks, hand washing, avoiding large groups, because the biggest difference is this new variant is just highly, highly contagious.
Yeah, I know that we're all concerned about the this vaccine hesitancy that we're seeing in some communities and some people. I'm wondering, and some people insist, especially this is on social media, that a lot of people in the medical community aren't all that interested in getting the vaccine. What's been your experience of your doctors and nurses, and how many of them are opting not to get it?
We have a majority of our team members now vaccinated, and we're really excited about that and pleased. I wish that I could report that we were at 100%, and we're not. But again, a significant majority of our team members, especially our clinicians, physicians, nurses, respiratory therapists, are vaccinated. We are very, very actively engaging with our non-vaccinated staff and answering questions, which is the same thing we would like to do for the community at large, because we are of the mind that vaccination is our long-term way. And it doesn't have to be that long, about 6 weeks post-vaccine to get that immunity level up, where that will tip our ability to stop these increased numbers. So again, answering a lot of questions. There's a lot on social media, a lot of misstatements. We're trying to get the facts and the truth out about the safety and efficacy of the vaccines.
Is that frustrating for you to have to make that case to some of your own staff members?
I would say it's our job, right? And I think that our staff that have questions just help us understand the community's questions. And it is fair, right? A lot of us are vaccine hesitant. And so our own team are great barometers of the questions that are out there. And as clinicians and administrators, we have to honestly and transparently be able to answer those questions.
Another thing that is changing, I think, is our ability to see and sort of read the data and understanding what that means for our problem and where we're headed. For instance, we used to look at the test positivity rate. That's really high right now, but I wonder, is that still a decent metric? We're up around 18%, but with the vaccine where it is and the variant, is that, do we need a new way of looking at how bad our problem is, or is it still the same?
We wish we had a better leading indicator, but I'm going to call it today yet our best indicator, that positivity rate. And so it is about 18% overall, as you know, in our Tri-County area, sometimes up to 20%. And so it does suggest that we still have at least a few more weeks of these high numbers of new COVID cases. And that's why we're really appreciative of these kinds of discussions, because we need everybody in Michigan to pay attention. We all want to get over this, right? We're all tired of doing the fundamentals of wearing masks, et cetera, but we need to hold together and get through this time frame until we're more of us are vaccinated.
I thought it was really interesting, the governor's remarks the other day when she was talking about a lot of the medications that people need to be receiving if they have COVID. It sounded like almost like a pharmaceutical ad. If you've got COVID, talk to your doctor about remdesivir or whatever it might be. But do you think that, are we still learning about how to treat this, or have we got it in a much better, do we have a much better handle on it now when somebody shows up at the hospital with COVID?
I would say I'm going to answer both because we know so much more than we did when we saw our first cases now about 14 months ago about the appropriate treatment, and we have more drug therapies available to us, and yet we have more to go. And again, I think what the governor was trying to say and what we would like to say is try to stay out of the hospital, right? If you can. I want to be very clear. Beaumont hospitals and our other hospitals in Southeast Michigan, they're safe, and we want anybody that needs hospitalization to come in. We will find room, absolutely, and provide very safe care. Do everything you can to avoid getting COVID, first and foremost. And then when you do get COVID, we want to try to use some of the drug therapies early to treat symptoms if you have them. Not everybody does. And everything is to try to avoid hospitalization and that higher level of care.
Well, here's hoping for better days ahead. Carolyn, I know you're exhausted. We talk a lot about the doctors and nurses. The administrators are really tired, too. I really appreciate your time today. Stay safe, and we'll talk to you soon.
Thank you, and thanks for helping us get the message out.
You bet. We'll wrap things up for Flashpoint right after this on Local 4.